It is a huge honor to be in London talking to one of the greats out of Scotland. And so you, Elaine Halley, is it Elaine Halley? Halley. You are a legend beyond legend for all my friends in London. And thank you so much for doing this podcast.
Pleasure.
So tell everybody, first of all, Scotland is a country in the United Kingdom?
Yeah, so the United Kingdom consists of England, Scotland, Northern Ireland and Wales. So we're all separate countries and within the United Kingdom. So Scotland recently had a referendum to see about whether we would go independent from the United Kingdom, and we voted to stay with the United Kingdom, but it's a subject that's always talked about. So we have our own parliament, we have our own healthcare system, we have our own rules, but we are also part of the United Kingdom and governed by London.
And now, when I'm here that week, now the country that you're a part of, the United Kingdom, is voting on pulling out of the euro, which is another layer of government in Brussels. What are your thoughts of that, and how will that go?
I think the general feeling is that people in this country are a little bit stunned about why we're being asked to decide on a subject so important as whether Britain should stay within Europe or not. So there's a lot of uncertainty, and most of us feel a bit unqualified to make that decision. So it was very different. Scotland deciding to stay or remain within the United Kingdom was an emotional subject. This stay within Europe or not becomes much more bureaucratic and what's the best thing for the country. So I think the general feeling is that better to stay with what we've got than upset everything. But whether or not the whole population thinks that, I don't know.
So you're a mover and shaker. Well, you have two offices.
Yeah.
So you're in Scotland. The capitals. You're in Edinburgh, and Perth. And what's funny is if you're an American, in your Australia, they have a Perth.
Yes.
So in the United States, we have a Cambridge. So these towns in the United Kingdom, you can find these towns all over the world. So you're in the original Perth, not the Perth, Australia.
Yeah.
So my first question is, why did you go from one office to two? What was all that about?
So I started my office in Perth about 21 years ago. It's 21 years ago this year. And Perth is a rural community. It's about an hour north of Edinburgh. It's a lovely place to live and to work. And then about 5 years ago, I had a bit of a midlife crisis, I think, and thought, I know how to do this in one location. I'm going to do it again. So just at a really tough economic time, I decided to open a brand new, we call them squat practice, a brand new practice.
Yeah, what does that mean, squat?
Squat means you're starting from nothing. So
that'd be, in America, that'd be the de novo, a de novo.
Yes, yeah, I guess, yeah.
So a de novo in the UK is a squat.
Is a squat,
okay.
Yeah, yeah. So I opened a city centre practice in Edinburgh right when the economy was going down, the banks were shutting. Edinburgh's a big financial...
2008?
Yeah. So
did you plan that, or is that
it wasn't my brightest move?
How was that move?
However, what it really did was meant that I put a long-standing good practice at massive risk, kind of on an ego trip of I want to open a second practice. But what it really did was make me focus in on what was working, what worked in our Perth practice, and how was I going to differentiate my Edinburgh practice and grow a fee-for-service private-only practice. So I have learnt a massive amount, and both businesses are stronger and better because we survived, and we had to really go back to our core values of serving our patient, serving our customer, and making sure that the dentistry we delivered was excellent, the customer service was excellent, so that we could survive that period.
So is your practice in the small rural area of Perth, is it NHS?
No.
It's all fee-for-service?
It's all fee-for-service. We are Cosmetic advanced restorative practice. I have associates and hygiene therapists that work with me, but we're based on a prevention model, a lot of aesthetic dentistry.
And then Edinburgh is the capital of Scotland. So how many people live in Edinburgh? That's a more urban city.
Yeah, so Edinburgh is just under 1 million.
And so was it a lot more competitive?
Much more competitive, and I kind of underestimated that because Perth is a city of only about 45,000, and I'm the only purely private practice there, so I have no real competition. Edinburgh is very different, city centre, a lot of other practices there, although I use the digital smile design model, which I'm sure you're familiar with Christian Coachman's digital smile
Brazil.
design. Yeah, so I've followed him around for the last 5 or 6 years, and now I'm part of the DSD team, partly because I used that model to build my Edinburgh practice.
Did you follow him around just because he was so handsome and good looking?
Didn't hurt.
That didn't hurt? Okay, I didn't know if his words were smart or if he was just that hot.
He came to Edinburgh as well. He has historic Scottish roots, so he came to my practice in Edinburgh.
Does he have Scottish roots?
Yeah, and did a consult. I think his grandmother was Scottish, so yeah, he has Scottish history as well.
I think the most interesting thing about him is the fact that you go to so many dentists in Brazil and India. Well, I think in his family there's 35 dentists.
Yeah.
And I've been into India and people's houses where there were almost that many dentists living in a single house. I mean, grandma and grandpa, 6 kids, all their kids, everybody's dentist, lab tech, hygiene, and they're still all living in one house.
Yeah.
I mean, it's amazing.
7th generation dentist technician, which is quite unusual. Yeah.
I mean, that's just, at that point, it's got to be genetic.
Yeah, it's in there. Yeah, definitely.
So, Elaine, in the United States, when I got out of school, it was considered a male profession. Mm-hmm. And now, 30 years later, it's half dentist, half female. How was that in England? When has the UK dentist become more female over the last couple decades than before, or not really?
When I graduated in 92, we were about 50-50 male-female in my class. What's interesting, though, I think about women in dentistry, I think the profession, and certainly the forecast for the profession in the UK, and even more so in some other European countries, are that it is becoming a slightly more female-led profession, or female graduating profession, than male. The opposite side of that, and the side that I am trying to pioneer and work with other women, is that the educators in dentistry are still mostly male. America, actually, I notice, has more female educators, but in Europe and in the UK, most of the leading educators in our profession are male. And in Europe, sometimes it's all male at the conferences, and that doesn't represent the profession. And I think we do need to have some work to do to try and turn that around, to encourage women to come out of just being in their practices, but also help educate.
And I remember I didn't even get out of high school yet. I got out of high school in 1980. In 1979, Margaret Thatcher was the first woman prime minister.
Yeah.
And I thought that was amazing, because now it's 2016, almost 40 years later, America is just considering its first female. We just had our first female win a major political party, Hillary Clinton. And now, so it's amazing how England was pioneered 40 years ago, because you were saying you got out of school in 92 and it was already half women.
Yeah. Yeah.
And that wasn't the case in 92 in America.
Okay.
So England's always been ahead of America, and especially all things, social. So what advice would you give? I want to say this. 82% of everyone listening to this is United States, and podcasters are generally under 30. So you're talking to thousands and thousands of young women dentists right now, and 4 out of 5 being in the United States. What advice would you give to the young women dentists who feel like they're entering a male profession?
I think women have a very strong position to play within dentistry, partly because we have that sort of natural empathetic nature. As often, if we're mothers, sisters, daughters, we have the caring side of the caring healthcare profession. I think what we're often more reticent to do is put ourselves forward for speaking engagements or for helping on hands-on courses. We're a bit more, we wait to be asked rather than volunteer ourselves. So I think for women in dentistry, I would find role models, other women that you see being successful in dentistry in the way that you would wish to mirror, and speak to them and get to know them and ask for their advice. Is certainly what I've done throughout my career, and I have a good network of women who are very successful dentists that I've been able to ask questions in tough times and be able to balance that whole motherhood, business aspect of life, which is in dentistry we're really privileged that we can balance, unlike some other professions like law or big business where you have to work and you have to compete with men with the long hours and all of that kind of rat race. In dentistry we can set our own hours and we can have some work-life balance but still progress in our career. So we're very fortunate. It's a very good profession to be in as a woman.
So what advice would you give? That was great advice to young women dentists. What advice do you give to all those young women out there who have one office and thinking maybe they want two? What would you say to the women dentists out there in one office thinking, well, you got two, should I do two?
That's a difficult question to answer. I think you have to really go back to what are you trying to achieve. So I didn't open to have two practices. I have ambitions to be bigger than that. Partly because I really enjoy working with associate dentists and helping to mentor young dentists and build a network of professionals. But that's me, and that's very personal, to my personality style. I think there is absolutely nothing wrong with having one well-functioning practice, and in a lot of ways things are much easier if you focus in on staying small. So I don't think there's a right answer to that. I don't know that I would recommend it. I think it depends. I think you can, if you're not averse to risk, then why not go for it? But if that's going to stress you out too much, then stay under control.
So the people who take all the insurance in America, the PPOs, 82%. In England, half take only NHS, and then another 40% take mixed. But you have offices just pure private.
Pure private.
Okay.
Yeah.
So what do you say to all these dentists out there who say, well, all the patients are just going to say, well, I just want to do whatever the insurance pay. I just want to do that. I don't want to use my money. I mean, how do you address that?
I'm a believer in when I graduated in dentistry, I wanted to provide the best that dentistry had to offer for my patients. So I believed that my job was to understand the science, understand what was clinically available, and then be able to give that as an option for my patient. So I quickly realised I couldn't do that under the health service, because the health service had rules and regulations about what you could and couldn't do that I didn't believe was in the best interest of the patient. That was my belief. So therefore, I think it's all about communication with your patient. If you can diagnose what's really going on in a person's mouth, if you can talk to them in human terms about what do they want for their mouth health, function, aesthetics, and you have a human conversation about, okay, well, these are your options, and this is how much it costs, but you're helping them make the decision that's right for them. I think nobody argues with that. If you educate and motivate your patients, the people who want your services will choose you, and the people who don't will go somewhere else. If they're looking for cheaper, they'll go somewhere else. If they're looking for being involved in their treatment and understanding what their choices are, then you may be the right fit for them.
And what percent of Scotland do you think is fit for your practice versus what percent of Scotland just says, I just want NH dentist to pay? I mean,
I think there's a core thing in the UK. Traditionally, we've been brought up under the health service to expect healthcare for nothing or next to nothing. So there's a the majority of the population don't want to spend money on their teeth, but generally that's because they don't understand what's going on in their mouth. So there's obviously an ability to pay issue when you're talking about private dentistry, but there's also people of all social economic backgrounds that come to our practice because they want the care and the service that we deliver. So I think you can't judge. I don't know what percentage of Scotland would take my services. I'm in one town of 40,000, I'm in one city of 1 million, and we're busy in both locations. So, I think there's a demand for what we do.
And what would you say there's the most demand for? I guess one of the questions they have when they come out of school is, okay, I just learned the basics in dental school, and I see that I could be taking courses in Invisalign, placing implants, CEREC, CAD-CAM, sleep apnea. I mean, there's just so many things. And she says, look, I'm 25. I can't take 19 different things at once. and you're in private, not just insurance driven. What are customers paying for in your private clinic that you think she should go out and learn more about?
I think the absolute place you need to start is with understanding communication skills and the psychology of decision making that your patients will go through, so that you're not so fixated on all the clinical techniques and can you personally deliver every single clinical technique, but you actually remember how to relate to the patient as a human being and hone your skills in this is what I see going on in your mouth, and how can I explain to you, Mrs. Patient, in terms that you understand. I think that is so neglected. I think a lot of young dentists jump straight into, I have to do the Invisalign course, I have to go on an implant course, and they get so caught up in the technology that they forget they can't do any of that if they can't relate to the patient and actually get case acceptance. So I think the other side of that is you don't need to be an expert at everything, but you do need to be able to recognize and diagnose everything, and then you can bring in other colleagues and build a network of colleagues around you while you focus in on the areas that you like. But if you just go and learn the clinical techniques without understanding the psychology of the patient, you're always going to be at a disadvantage.
And who would you recommend training them for that? Who do you think they should listen to?
I think a variety of speakers. I think within the dental industry, we need to understand case presentation skills and diagnosis skills, treatment planning courses. These kind of start at the beginning rather than starting at the end, which is the tool for whatever the dentistry is. So I think some of the best teachers are people that have been in practice for a long time and have really studied the skill of talking to patients. But there's also examples, I would say, outside of dentistry, within other industries like the hospitality industry, other industries that you can go to and listen to best practice in customer service, best practice in decision making, and communicating with people. So it's just broadening your awareness, I guess, away from just what I do with my hands to dentistry is about smiles and human beings. It is about personal relationships, and we can get too focused in just on the dentistry.
The best thing about life is being born with people, and the worst thing about life is all the people. I mean, if you're born on Earth and you're the only person on Earth, I think it'd be a very bizarre experience. But these young kids, when they're working in office, if they're an employee, they say the hardest thing that the biggest stress is the politics of the office. Mm-hmm. And then if they go start their own office and now they're the owner, they say still the hardest thing is managing the people. What tips would you give my homies if they're working as a dentist and getting along with the owner doctor, the other social people, or now they've made that step, they're an owner and now they're trying to lead a team? What have you picked up over the years that you could...
I think there's a few things you can do. I think studying leadership is an important part of your own personal development. So studying what does it take to be an effective leader just through your own reading and research is important. I think also building people around you that can help you with that. So certainly myself, I've got practice managers and a management team that have worked with me now for 15, 20 years. I take them on training courses with me. We've traveled to the States. I know not everybody can do that, but I've made that a priority that I need my key people to be with me and that we function as a team, not just as an individual. So my leadership style is certainly not, a dictator. I'm much more, part of the team, and we grow our business together. So I think if you're an owner, you have to really be strict about people that are on your side and people who aren't on your side, and don't tolerate the people that are not part of your work family. Get rid of them and get the next person in. And sometimes that means you might have high turnover for a while till you find the right people, but don't tolerate people that don't share your values, that are not on your side. I think if you're part of another team where you don't have that control, again, working on your communication skills and realizing that people have different personality styles and communication styles, and learning how to adapt your own style to try and have the most effective relationships.
What does, in my office as the owner, what does I tell an associate dentist with 2 black eyes?
What do you tell your associate who's come to work with 2 black eyes?
No, I said, as an owner dentist, what do you tell an associate dentist with 2 black eyes? Nothing. I've already told him twice.
Okay.
Another dumb joke on the Dentistry Uncensored. What's got you excited now? You've been doing this for 2 decades, right?
Yeah.
So what's got you passionate now? Why are you not burned out? A lot of these dentists have 2 decades saying, you know what, Elaine, I'm burned out. I hate this. I just do it for money. You know, after 2 decades of doing the same thing, working in humans' mouths, what's got you excited after 2 decades? How come you're not burned out and drinking beer on the way to work every day?
So coming back to Coachman, the digital
Notice she
smile
didn't
design.
deny the beer on the work day. The first thing she did is not deny it. No, I'm just kidding.
What gets me excited is still the psychology of improving people's smiles. And the reason I got so excited about the digital smile design as a communication tool is because we now have all the smartphones and the easy technology for us to be able to capture videos of our patients, link in all the communication with our dental technicians, with our specialists, and really build a big team around myself as an owner dentist working in a previously isolated situation. With modern technology now, I can have a network of colleagues throughout the world that make me feel part of a team. So that is what really excites me now, is I think the future of not expensive digital dentistry, but digital communication within dentistry helps us to bring our patients alive for our dental technicians. They can see video and photography.
So you're talking again about
Christian Coachman, yeah.
Christian Coachman,
So he's
out of São Paulo, Brazil?
Sao Paulo, Brazil. So he has developed this concept, but it's really a communication concept as
What's
well
the
as a
website?
treatment planning. DSD, Digital Smile Design. He's big on Facebook.
Yeah, we did a podcast with him.
Yeah.
So, but what's the it's digital
Smile Design.
Digital Smile Design.
And the concept has evolved, but it's really about communication. And so I think what's exciting is the fact that wherever you are in the world, you can work with technicians, you can work with specialists, you can work with colleagues and communicate information about patients to generate better treatment plans, better communication with patients, and ultimately better outcomes for your patients. And that's better education for young dentists being part of a team, you know, of more minds. And that's really, digital smile design.
So digitalsmiledesign.com. And that's got you really excited now.
Yeah. Like aesthetic dentistry did maybe 15 years ago when we first joined AACD. There was a group of us from the UK, went to America, and then we started the British Academy of Cosmetic Dentistry on the back of what we saw at AACD. Those were exciting.
And you're
times.
now the president, are you?
I have been. I was the 3rd president.
Congratulations.
Thank you. Only female president so far. We need another one, but so that was exciting times.
Well, I might be another one. I'm pre-transgender right now. So after my operation, I'll apply. Do I have to get a Scotland license or a London license?
I know. It's all one country.
It's all one country now. So when you look at the British Academy of Cosmetic Dentistry, what does that really mean? Is that more bleaching? Is it more veneers, or is it more just routine dentistry looking more natural?
The BACD has evolved like all cosmetic organisations, but really we're a not-for-profit organisation. We're about education and bringing the best education to dentists and team members. And it has evolved much more away from veneers and full smile design into more minimally invasive dentistry, like, you know, it should be these days. So there's a lot of align bleach bond cases, so trying to keep the teeth intact and healthy but move them into the right position, but through general practitioners delivering that kind of care for their patients.
I want to ask you this. This is a very political question. I don't want to get you in trouble, but when I got out of school, if your teeth were really, really crowded and you didn't want to do braces, the dentist would just file them all down and do crowns or veneers. Sometimes they'd even root canal some of the laterals so they do crowns. And now you see a lot more dentists doing Invisalign or unwinding a lot of this before they start doing veneers. So do you really think you can be a cosmetic dentist and worthy of the British Academy of Cosmetic Dentistry if you can't unwind some of these cases with orthodontics, Invisalign, whatever? Can you be a cosmetic dentist without orthodontic skills?
No, I think it comes back to treatment planning again. When you start treatment planning, most cases you need some kind of ortho or tooth movements at least to undo what's happened, so that you can then present an ethical solution to the situation. A lot of it comes down to consent from the patients, but ortho has to be part of that consent process. So certainly in the UK there are a lot of general dentists, and we graduate with the ability to do orthodontics. We don't have to be a specialist orthodontist, although you have to acknowledge that you're not a specialist orthodontist. So I think certainly orthodontics now, and certainly at the BACD, is part and parcel of all treatment planning, and it should be part of the consent process for patients. Whether you carry it out yourself as a general practitioner or whether you work with an orthodontist depends on the complexity of the case.
I want to ask you another. I love talking to international dentists because all these different countries have different tribes, customs, cultures, whatever. But in the United States, I find a severe dissociation between the dentist and the public, and the fact that the dentist, if a dentist puts anything on their website about naturopath, all natural, all that, the patients are driving an hour across town. But when you talk to a dentist and you start talking, well, do you want to be a naturopath or all natural or whatever? They just say that's quackery. I'm not a nut job. Get out of here. So why do you think patients are attracted to, or another word, alternative healthcare, alternative medicine, naturopath, whatever? Do you see any of those in the United Kingdom?
We do. I think there was a big kind of upsurge in that maybe about 10 years ago. We had a lot of homeopathic dentistry and amalgam-free practices, and it seems to have, the curve of that seems to have died down a bit more. There's lots of practices like myself, I don't place amalgam. We have lots of amalgam-free practices, but still on the health service you have to provide amalgam. So And we have to tell patients that they could go to a health service practice and have an amalgam if that's what they want.
So why do you not use amalgam?
I don't believe it is I don't like the properties of amalgam as a restorative material. So I prefer, Pascal Magnier is one of my mentors.
Out of Brazil?
No, he's from Switzerland, but he now works at the University of Southern California.
Oh, okay.
So I believe in bonding, and I believe in maximizing the amount of tooth structure there, and I don't believe that amalgam really fits into that. I do, however, know that's a philosophy, and there's evidence, for amalgam as a good restorative material, but it doesn't fit with my personal philosophy.
I agree, because when I was in college at Creighton University, I went there, I had no cavities. After 3 years of college, I had 8 occlusal amalgams, and then later I made Ryan. And look at, dude, I just see amalgam toxicity written all over that guy. Ryan, I'm so sorry. I want to ask you a favor. The number one complaint we get on Dentaltown Online CE, so Dentaltown has 217,000 dentists. We came out with the app. Now the app has I think it just passed 50,000. Anyway, we put up these courses. It's something like 340, 360. They've been viewed over 600,000 times. My number one complaint with all this, and it's true, it's all males. And so there's Gary Takis.
Yes.
I do. So when I was in dental school, the senior class had one girl.
Okay.
And then now it's 45% women. And these young girls in dental school, they don't want to go to Dentaltown and see a bunch of short, fat, bald guys doing all these courses. So I want a course from you someday.
Okay.
It could be on anything. They need American women dentists need so many role models. And what's tough is so many of the women dentists that are my age that could be role models, they say, I don't have the time. I'm married. I got 3 kids. I just don't have the time. Whereas so many of the men role models let their wife do all that stuff, and they just do dentistry. And so many women just can't do that. But I think the world of you. I'm so proud of you being the first president of the. You're the Margaret Thatcher of dentistry, and so you think
America's dress sense, I hope.
do you think the United States will finally get its first Margaret Thatcher? Do you think the election coming up? Do you think Hillary Clinton will be the first?
She's in with a chance, I think. I don't know, but yeah.
Yeah, you know, I got to tell you, I probably should not say this, but Ryan, I think I'm going to say it. You're never supposed to talk about politics, religion, sex, violence, any of that stuff. But you know, it was 1979. I was 16 years old, and I was born in 62, and I graduated from high school in 80. And Margaret Thatcher was elected, and I was in the middle of Kansas. That's country. Yeah. And I mean, men were dumbfounded because England's our mother country.
Yes.
And I remember my dad and their brothers, and I remember men at church saying, "What the hell would they? What the hell are they thinking? Why would they do that?" It'll make them the Russians and no one will fear her.
Respect for
and they were confused, and then she turned out to be the Iron Lady
woman.
And attacked the Falkland Islands, and I mean she was like the meanest, toughest man England ever had, and she was in a dress. And I can still remember. I can still remember being 16 and seeing all the 40, 50, 60-year-old men in Kansas just like, what the hell? And then as they watched her, then it was really like, whoa, what the hell? I mean, that was it was like, it was deal. But I hope America sometimes, on behalf of my 2-year-old granddaughter.
Yes.
So I had 4 boys, and a lot of people are mad at me because they say I'm going to vote for Hillary, but the bottom line is I don't want my 2-year-old granddaughter to grow up in a country where to get the top job, every one of them had to be a boy.
Yeah.
And what you're saying is that in dental school, too many of the instructors are boys.
Yes.
And what I'm telling my homies, that what upsets me the most is when young girls tell me that they're going to study clubs in country America, Texas, Oklahoma, Nebraska, Kansas, and they go in there and they feel like they're sitting at a table by themselves and they don't feel welcome. So if you're a 50-year-old old fat homie like me and some little young 25-year-old walks into that damn study club, you know, call her over, say, come over here and sit with the boys. And if you're in a dental school, let's start getting some women in there. But thank you for all that you've done for dentistry. You're a leader, a pioneer.